Britain's oldest hospital has become its newest with the opening of one of the most advanced cancer centres in Europe. At Barts, we're passionate about what we do. Our doctors have been responsible for many advances over the last 900 years. We pioneered the use of surgery and radiotherapy to treat cancer, now standard practice throughout the world. We're continuing to introduce new approaches, from the latest radiotherapy to gene therapy to the newest drugs available anywhere in the world.
I was first diagnosed with testicular cancer in 1988. This was successfully treated with the removal of one testicle. Unfortunately, I was diagnosed again with testicular cancer in 2002. I was initially offered surgery only, so I sought a second opinion at Barts, and they recommended a course of chemotherapy with the new drugs that the research had produced and funded. And at the end of the summer of 2002, I was cleared. I met my now wife, Katie, and 4 years on, after we got married, we've got two lovely, lovely daughters. And without the treatment, none of this would be possible.
We're immensely proud of what we do here, but we need your help to achieve the funding necessary to do more research to change the lives of patients with cancer. People used to call cancer the big C, some still do. They called it that because more often than not, it was a death sentence. They were so frightened of it, they couldn't even say the word. It was taboo. With your help, we can turn the big C into a small c. Over the years, we've cut many cancers down to size. Detected early, these cancers become not only treatable, but survivable. Thousands of patients in this country die every year because their cancer just wasn't detected at the right stage. Some of the most challenging cancers simply don't have symptoms until they're too far advanced to treat. We're developing tests that allow us to pick up the disease at a very early stage, looking at markers in the blood or even in the urine. It's incredibly exciting work, but it's expensive, and only with your help can we bring it into the clinic to help those patients who need it most. Your chances of surviving any particular type of cancer are directly related to the amount of money that's being spent on research into it. We need your help to invest more intensively and drive survival rates up. That applies particularly to the most challenging cancers, such as pancreatic, ovarian and lung, which are very difficult to treat, even when diagnosed relatively early.
We're now moving away from an era where we're using chemotherapy to treat all cancers, moving towards a much more individualized treatment of cancer. We now aim to translate our own work from the laboratory to the patients. We have access to patient samples to bring back to the laboratory to understand whether or not our new drugs are indeed hitting the targets and whether those are having an impact on the outcome of our patients with cancer.
Patients who are no longer responding to conventional forms of therapy may be candidates for research trials of novel approaches carried out in our Centre for Experimental Cancer Medicine, an integral part of the Cancer Hospital. There are only a select number of these centres in the United Kingdom, and they're highly specialised. As well as these highly experimental trials of novel agents, we have over 100 clinical trials open at any one time, covering a wide spectrum of cancer types. We think it's really important that such a high proportion of the patients who are referred here have an opportunity to take part in these clinical trials. Thanks to the donations that we receive, we have some of the most advanced technology for screening, diagnosis and treatment anywhere in the world. We'll be able to pick up cancer earlier and more effectively. We'll be able to treat it more effectively, and that will be thanks to you. Your money can make all the difference to how our patients do, from the small things that improve their time while they're in hospital, right through to the big things.
This is the West Wing, which is our innovative breast care centre that was made possible by generous donations to enable us to develop this within the NHS, where we can provide all the facilities for screening, for investigation and treatment of patients with breast abnormalities. To complement this, we are also now planning to develop a patient support centre where we can provide the personal care, information and support for patients both during and following their treatment.
Even smaller donations to the charity can make a real difference to patient care. Our portable chemotherapy assessment computers means that we can deliver more care at the bedside, giving patients face-to-face contact, identifying the problems with their chemotherapy and solving them for them. And this really has improved the patient experience.
I was successfully treated for Hodgkin's lymphoma about a year and a half ago. And having gone through the experience, I really wanted to give something back to cancer research. So I did a bike ride across the Alps and managed to raise £150,000 for a research post into immunotherapy. And it's very rewarding giving to Barts, where I know the money is going directly to that cause.
If you're thinking of donating money to Barts, I can promise your money will be well spent. And you'll not only be improving the lives of patients who have cancer today, but you'll also be improving the outcomes for those who may have it in the future.